I'm sure you've heard about the word stroke and you've been wondering what actually is a stroke. What are some symptoms of a stroke and how can I easily prevent a stroke? Stick around and I'll tell you all you need to know about strokes. For my people who are new, welcome to Health Corner. I am Dr. Nindi Shalom and I bring to you all the health information that you never thought you needed so you can make informed and better health choices every day. Let's get right into it. A stroke, simply put, is a medical emergency that occurs when there is loss of blood flow to an area of the brain. I want you to imagine it like this, right? You have a water pipe, and in a water pipe, it allows for the continuous flow of water through the pipe to its designated outlet. So imagine that for some reason there is a blockage in the pipe and water cannot flow to its outlet, or there's a tear in the pipe and water starts to come out in the wrong place. This is how a stroke occurs, but I want you to imagine this in the brain. There are so many blood vessels in the brain, and their primary function is to supply blood to different areas of the brain. If anything occurs that impedes or disrupts this supply to any area of the brain, it causes a stroke. There are two types of stroke. The first one is an ischemic stroke, and it occurs when there is a blockage in the blood vessel, right, impeding blood flow to an area of the brain. And the second one is called a hemorrhagic stroke. This one occurs when there is bleeding in the brain, either due to, a breakage or a leak or whatever that happens in the blood vessel. There are so many things that can cause a stroke. However, stroke commonly occurs more in men than in women, and it also occurs in people who are older in age. Starting from the ages of 55 to 65, stroke commonly occurs as well. Once you get to greater than 75, it is even more common. Statistics have shown that 1 out of every 4 men will develop a stroke by the age of 85, and 1 out of every 5 women will develop a stroke as well by this age. This doesn't mean that stroke cannot occur in young people. It does occur in young people. A stroke is also very common in people who smoke, people who consume large amounts of alcohol, people who are physically inactive, people who have had a previous stroke, people who are on oral contraceptives, people with diabetes, and people with hypertension. You should know that hypertension or high blood pressure is the #1 cause of stroke because it damages the blood vessels over time, making it more prone for a rupture to occur or for a blockage or a clot to form. Other causes include diabetes, high blood cholesterol, heart diseases like atrial fibrillation or ischemic heart disease. You also have blood disorders like hemophilia and sometimes blood cancers. Sickle cell disease can as well be a cause of stroke. I bet you didn't know that, right? Here are some common symptoms of a stroke you should never ignore. Number 1, sudden weakness or numbness on one side of the body. It could affect the arm or the leg or both. Number 2, weakness on one side of the face. So you realize that one side of the face looks like it dropped, right? We call this a facial droop. If you notice sudden weakness or numbness on one side of the face, this could be a sign. Number 3, sudden severe headache. So out of nowhere, you just notice that you're having this really bad headache, or it was like a thunder, right? Just this thundered sound that went up in your head and you're just feeling this terrible headache. That could be a sign. Number 4, sudden difficulty in speaking. We call this slurred speech. So out of nowhere, you just realize that you're unable to pronounce words or the words are not coming out well. This could be a sign. Number 5, confusion. So the person may be talking disoriented or what they're saying does not make sense all of a sudden. This could be a sign. Number 6, blurred vision. So all of a sudden you realize that you're no longer seeing well, or your vision is like blurred or clouded, or just like sudden blackout for a moment, this could be a sign. And finally, in some cases, you can experience loss of consciousness or even seizures or convulsions. If you notice any of these symptoms, or you find someone who is experiencing these symptoms, you need to rush them to a hospital as quickly as possible, because the earlier you get there, the earlier we diagnose the stroke, the better the outcome. Here are some few ways that you can prevent or reduce your risk of developing a stroke. Number 1, eat a healthy, balanced diet. Eat foods that are low in fat and are low in cholesterol, especially saturated fat. Number 2, reduce your salt intake, especially for my people with high blood pressure. Number 3, exercise regularly. Try to exercise for at least 30 minutes every day, 4 to 5 days in a week. This really goes a long way to help keep you active, to help movement in your joints and get blood flow, get your heart pumping, just keeps you well, all right? Number 4, keep your blood pressure within the healthy range, especially for my people with hypertension. Take your medications regularly and improve your lifestyle. Number 4, quit smoking. Smoking is one of the major risk factors for a stroke. So if you realize that you are more at risk of developing a stroke from some of the previous things that I have listed, stay away from smoking, please. Smoking is absolutely not for you. Number 6, maintain a healthy weight. This goes a long way in reducing your risk for stroke, because it reduces the chances of you getting diabetes, of you getting complications with metabolic syndrome, atherosclerosis, high blood cholesterol, and so many things. You want to make sure that you keep your weight within that healthy range. Number 7, consume alcohol in moderation. If you can actually stop, even better. Number 8, reduce stress. And finally, number 9, go for regular health checkups. This helps us to be able to catch some of these diseases like diabetes, hypertension, heart diseases on time. Always remember, your quick response once you notice some of these signs and symptoms of stroke is critical in minimizing brain damage and improving recovery outcomes. So don't hesitate. Once you notice any of these symptoms, go to a hospital immediately. Thank you so much for watching. Please share this video if you found it helpful, because that is how you build awareness. Don't forget to check out my previous videos if you haven't yet. Like, subscribe, follow me on all my social media platforms so you don't miss out on any other updates. Thank you so much, and I'll see you in my next episode. Bye-bye.